The drug that I am talking about today is furosemide, also known as Lasix, Delony, Furocot, and Low Aqua. The company that makes this drug is Sanofi Adventis, and it was approved by the FDA in July of 1982. Furosemide is a powerful diuretic that is used to treat excessive accumulation of fluid and or swelling of the body caused by heart failure, cirrhosis, chronic kidney failure, and the nephrotic syndrome. It is sometimes used alone or in conjunction with other blood pressure pills to treat high blood pressure. Furosemide comes in tablets, an oral solution, or as an injectable. The tablets come in 20, 40, or 80 milligrams. The oral solution comes in as a 10 milligram milliliter or a 40 milligram 5 milliliter solution, and the injectable comes in as a 10 milligram 5 milliliter solution. Furosemide should be stored at room temperature in a light-resistant container. Furosemide is usually taken once a day in the morning or twice a day, once in the morning and once in the afternoon. Furosemide is typically given to adults and sometimes children, and the usual starting dose for treatment of hypertension in adults is 40 milligrams twice daily. The starting oral dose for children with edema is 2 milligrams depending on their body weight, which can be increased by 1 to 2 milligrams every 6 hours until the desired effect is achieved. However, doses greater than 6 milligrams are not recommended. Onset of action after oral administration is within 1 hour, and diuresis lasts about 6 to 8 hours. Onset of action after an injection is 5 minutes, and diuresis is 2 hours, and the terminal half-life is 2 hours. Furosemide inhibits primarily the absorption of sodium and chloride, not only in the proximal and distal tubes, but also in the loop of the Henle. It is extensively bound to plasma, mainly albumin. Adverse effects of furosemide are muscle cramps, weakness, dizziness, confusion, thirst, upset stomach, vomiting, blurred vision, headache, restlessness, and constipation. The more serious adverse effects may be fever, sore throat, ringing in the ears, unusual bleeding or bruising, loss of hearing, severe rash with peeling skin, difficult breathing or swallowing, and rapid excessive weight loss. There are special precautions to take before taking furosemide. It is to tell your doctor if you're allergic to furosemide or sulfa drugs or any other drugs. Administering furosemide with aminoglycoside antibiotics or uracil acid may cause permanent hearing damage. Use of furosemide with aspirin may lead to high blood levels of aspirin and aspirin toxicity. There are no adequate studies of furosemide in pregnant women, and nursing mothers should avoid breastfeeding while taking furosemide because it is secreted into the breast milk. Furosemide may make skin sensitive to light, therefore exposure to tanning beds and excessive sunlight should be avoided. Other drugs to avoid while taking furosemide are chlorohydrate, corticosteroids, NSAIDs, cyclosporine, dioxin, laxatives, licorice, lithium, methotrexate, phenytoin, salicylates, sucralfate, and other blood pressure medications. A patient may be given a special dietary instructions once the furosemide is started, such as a low sodium diet, potassium supplements, and increased potassium-rich foods. Patient monitoring is needed when taking loop diuretics. Checking renal function and electrolytes should be done about 1 to 2 weeks after commencing therapy and increasing the dosage. This should be done within 5 to 7 days if the patient has